Hello, my dear friends. Welcome back to another episode of Dr. Arya's Vlogs. Today, I am going to discuss a fresh topic that is mouth preparation in complete denture. In the previous lectures, we have discussed residual ridge resorption in detail. You can watch that videos also. So the mouth preparation, it includes all the measures taken to correct tissue discrepancies that poses a difficulty in the placement of a denture. And the mouth rehabilitation is defined as restoration of the form and function of the masticatory apparatus to as nearly normal as possible, according to Glossary of Prosthodontic Terms. What are the objectives of the mouth preparation? It improves denture foundation, it improves ridge relations, it enhances the support, restoration of form and function of stomatognathing system, and it improves aesthetics. So these are the objectives of mouth preparation. The mouth preparation involves the following steps. They are elimination of infection, elimination of pathology, tissue conditioning, nutritional counseling, and finally pre-prosthetic surgery. So what is the elimination of infection? The infections arising from remaining carious teeth or periodontally weakened teeth or any ulcers and non-vital teeth should be eliminated. And the fungal infections like candidiasis, viral infections like herpetic stomatitis and denture stomatitis must be treated prior to the commencement of the treatment. And the elimination of pathology is that the patients must be educated and informed about the danger involved if the lesions are left unattended. And the tumors and cysts of the jaw should be treated or surgically excised. And what is tissue conditioning? The deformed tissues are allowed to return to normal by asking the patient not to wear the old dentures for some time and conditioning the tissues using soft liners. Then the nutritional counseling is essential to prevent any nutritional deficiencies, and this is very important for the patient whose metabolic and masticatory efficiency may be compromised. And final step is pre-prosthetic surgery. These are the surgical procedures designed to facilitate the fabrication of a prosthesis or to improve the prognosis of the prosthodontic care according to GPT 9. So these are the various steps involved in the mouth preparation. So the mouth preparation involves mainly two methods, non-surgical methods and the surgical methods. So what are non-surgical methods? The denture bearing areas allowed to rest 48 to 72 hours before final impression made. And the correcting the occlusion, that is the optimal vertical dimension of occlusion should be restored using interim porcelain lining material. And provide good nutrition and conditioning of the patient's musculature. That is, jaw exercises can be advised to help relax muscles of mastication and strengthen the coordination. So these are the steps involved in the non-surgical methods. And what are the non-surgical methods? Tissue conditioners, adjunctive care, removal of the retained dentition, removal of unerupted teeth, removal of retained roots, correction of hypermobile ridge tissue, and removal of soft tissue interferences. So the tissue conditioners can be used to reline areas with tissue damage, and they are composed of polymethyl methacrylate and an aromatic ester ethyl alcohol mixture. So it should be changed every 72 hours to 3 weeks depending on the extent of tissue damage. So these are tissue conditioners. Second step is adjunctive care. The ulcers, lesions or abscess require immediate attention and the lesion should be cured and the tissue should be given adequate rest for sufficient healing. Removal of retained dentition. The decision to remove or preserve the tooth is planned during treatment planning. An OPG gives a clear idea about the status of remaining dentition. Then fourth one is removal of unerupted teeth. Any unerupted teeth lying close to the ridge should be removed. Deeply submerged, non-symptomatic teeth with normal bony trabeculae can be left untouched. Then removal of retained roots. All retained roots should be removed, especially if there is any sign of pathology. Then correction of hypermobile ridge tissue. The hypermobile tissues result due to excessive residual ridge resorption. So the small areas, if any small areas there, which may not affect the functioning of the denture, then can be left untouched. And the mobile tissues should be recorded carefully using a mucostatic impression. If there is large pendulous hypermobile tissues are there, then it should be removed. Then final one is removal of soft tissue interferences. So firm soft tissue interferences which do not affect the stability of denture can be left intact. And in case of a maxillary tuberosity with excessive fibrous tissue, the need for surgical removal is evaluated by articulating the diagnostic cast. So these are the various methods of non-surgical methods. Then coming to the surgical methods. These are the surgical methods, that is soft tissue procedures and hard tissue procedures. What are the soft tissue procedures? Removal of hypertrophic maxillary labial frenum, removal of hypertrophic lingual frenum, correction of prominent buccal frenum, removal of papillary hyperplasia, treatment of epulis fissuratum, and vestibuloplasty. These are the soft tissue procedures. And the hard tissue procedures are extraction or alveoloplasty, removal of ridge undercuts, management of prominent mylohyoid and internal oblique ridges, reduction of maxillary tuberosity, treatment of sharp spiny ridges, and excision of torre or exostosis. So these are the soft tissue and hard tissue procedures. So coming to some pictures involved in the mouth preparation. So this is the picture showing normal labial frenum and hypertrophic labial frenum resulting in frenum attached close to the crust. So in this picture, it is clearly shown the normal labial frenum in the first picture and the hypertrophic labial frenum which is resulting in the frenum attached close to the crust. So this is the hypertrophic labial frenum and this is the normal labial frenum. And in this picture, it shows the normal lingual frenum and this is a sagittal view showing normal lingual frenum. Okay, normal lingual frenum. And here is the hypertrophic lingual frenum which obliterating the lingual sulcus. And this is the sagittal view. Okay. And here the most frenula need to be accommodated in the denture's peripheral extensions. Both the anterior labial maxillary frenum and the mandibular lingual one can be prominent and particularly active. And they have to be looked out for when making final impressions and at the time of finalizing the fit of the processed denture bases. So these are the removal of hypertrophic maxillary labial frenum. Then this is the hypertrophic lingual frenum can be removed. And then this is the prominent buccal frenum can be removed. So here the technique used for the removal of hypertrophic maxillary labial frenum is diamond excision. Diamond excision is the technique used. And the other techniques of frenectomy include Z-plasty technique and VY advancement. So the removal of hypertrophic lingual frenum. So frenectomy is indicated for cases with the hypertrophic lingual frenum. So here the surgical management should be done. Tongue tie test should be done to determine the need for surgical correction. The patient is asked to touch his upper lip with his tongue. If the lingual frenum produces the displacement of the denture, then frenectomy should be done. Then this is the correction of prominent buccal frenum. Here this is the buccal frenum is prominent. Usually they never present themselves large enough to warrant surgical correction. The buccal frenum is soft and hence it can be easily displaced by the denture without producing any injury. Then fourth one is the papillary hyperplasia. This is the picture showing papillary hyperplasia. These are hyperplastic lesions which occur in localized areas due to some form of irritation. So due to some form of irritation that occur in a localized area, and the lesions are either small or large, and if the lesion is small, it is treated by curettage. And the large lesions are treated by split thickness supraperiosteal excision. So this is the split thickness supraperiosteal excision is shown. It may occur due to poorly adapted dentures or candida albicans worsened by poor oral hygiene or wearing dentures at night. So here it is the picture showing Epilis fissurata. It is a soft tissue reaction that appears in the sulcular region due to overextension of denture flanges. It is commonly seen in immediate denture cases where the rapid ridge resorption occurs. It does not require any special treatment. Shortening and smoothening the denture border is sufficient. Once the tissues heal, the borders of the denture should be refined. Carbon dioxide lasers and Nd:YAG lasers are now being used to remove large lesions that occur in the vestibule and are considered as the gold standard. So, gold standard in the treatment of Epilis fissuratum is lasers. Okay. So, in this lecture, we have discussed the various soft tissue procedures involved in the mouth preparation, and from the next lecture, we will discuss the hard tissue procedures in detail. Thanks for watching. Stay home, stay safe.